Good evening. I'm Cliff Syner. I'm a PA here at the Maxwell Clinic. You may have seen me from a few of these other group visits before. I really enjoy doing these, and I don't know if you guys know, but we get to pick our topics. So usually my topic is going to be around either something I've been helping patients a lot with lately, or something that's just really been on my heart or my mind, something that I feel like is an important topic. And that's the case for this evening. We're going to be talking about anxiety through a functional medicine lens. So just a couple of housekeeping things. Please, I would encourage you to write me a question. And then at the end of this, then I'll go through those questions and make sure that I answer those before we finish up. Other than that, I think that's about it. So let's get started. So today's goal really is curiosity. So we all know what anxiety feels like, even if we can't clearly define it, either philosophically or even neurobiologically, which is what we're going to talk about this evening. Even if we can't get that definition just right, we know what it feels like. So what I'm hoping is that at the end of today, that you'll be able to be curious about anxiety. When you feel like stress is really bearing down and it feels overwhelming, be curious as to what could be leading to that, and then that can lead us to what we can do to help resolve it. Now, the idea is not to resolve all of our stress or all of our anxiety. If you heard me talk about stress before and inflammation, those are actually good things for the body. We need those to keep moving, to keep living, to keep breathing, to grow stronger, both in our emotional relationships and in our own bodies. So we're not trying to totally get rid of anxiety, but we do want to prevent it from overwhelming us. So anxiety defined. So as you see here, we've got a few different pictures. So often we'll talk about anxiety and we may hear something about plates, right? We may say, I have too much on my plate, right? And so we can see here, that picture in the lower left, there's definitely a lot on that plate, right? Not all that healthy, I might add, but hey, that's neither here nor there. In the end, there's just a lot on the plate. Then in the middle here, you see a plate that has very little on it. So, you know, when we talk about having too much on our plate, there's actually two things going on here. So there's the amount of things that we actually have to think about, right, that we have going on in our life. So maybe we have a job, we've got family issues and things that we are responsible for. Maybe we have stuff going on in the community that we're responsible for. It could be a number of other things, and all of those different things could be what's on our plate. We could also think of it as the size of our plate, right? Maybe we don't have a whole lot of things on our plate, but we still feel overwhelmed. Maybe it's because our plate is too small. You ever thought of that? It's kind of an interesting idea, right? That maybe it's not that there's too many things, maybe my plate's just too small. So in functional medicine, we can actually work, and we're going to be talking about this evening, how can we make our plate bigger? So another way to talk about this same idea that you may hear about in therapy or in the counseling realm would be a window of tolerance. So we all have a window of tolerance, like how much can we handle? And sometimes that window of tolerance may come up if we're talking about maybe conflict with a spouse. And if we have a small window of tolerance, it means we can handle very little conflict before we're overwhelmed. And once we reach a sense of being overwhelmed, there's really no use in continuing the conversation. It would be best to take a breath, step back, go think through it, go take a few breaths before we re-engage that. Because once we get outside of our window of tolerance, we're no longer thinking with our frontal cortex. We're no longer able to reason appropriately. And we all know what that can look like once we get outside of that window of tolerance. So another way to think about anxiety is neurobiologically. So that is looking at the limbic system, and the limbic system is what I have here illustrated. So it includes the hippocampus, which are these two blue areas of the brain right here that go up and around. And then you've got the amygdala. And so the amygdala, you see it right here and right here. So the amygdala is what I really want to focus on this evening. This is the part of the limbic system that remembers. So this is emotions, memories, and arousal all come from the amygdala. So let's say that in your past, you have a traumatic or very anxiety-inducing experience. Your amygdala remembers that. And so even though you may be going through something now where you think like, oh, this is not that big of a deal, like I should be able to get over this, right? I should be able to move past that. Well, I want to encourage you that it's not your fault. Rather, it's your past. Because let's say that, you know, in your past, you have an experience of being chased by a lion. So now it may be that every time you see a picture of a lion, or you see somebody running, they could be running from a lion, or you hear a roar, or even a loud noise, your amygdala remembers that life-threatening situation in which you were in. And to keep you alive, it sends signals to the rest of your body to react exactly how you reacted when you were being chased by a lion. The way that you needed to react in order to live. So this is not a problem. This is not a broken system. This is a system to protect you. And it could be that that system is sort of stuck in overdrive. And if that's the case, then that's something that needs to be explored. That's something that needs to be dealt with. And there's going to be multiple ways in which you can engage that, and you can do that. And we'll talk about those a little bit later. But I just want to introduce everyone to this idea that when we feel anxiety, it's not necessarily about what is happening in the present moment, but it can be rooted in our past. And that's something that needs to be engaged with. It needs to be dealt with effectively so that we can live in the present moment in balance. So 5 strategies that work together in order to help control or decrease our anxiety. These 5 strategies, they may look familiar, right? These are the lifestyle factors that we talk about in functional medicine. So normally, if you've seen the matrix, the functional medicine matrix, then you're going to see these lifestyle factors at the bottom. So nutrition. Let's talk about how nutrition can impact our anxiety. So if we are highly inflamed, or if there is a significant amount of oxidative stress in our body, then this increased inflammation is going to sensitize our nerves and make it more likely that we're going to feel a sense of anxiety or be very easily triggered into an anxious state. So we can decrease that oxidative stress, those free radicals. We can decrease that by doing something called eating the rainbow. So we talk about a rainbow because we're talking about food, and we're talking about eating multicolored food. So I'm not talking about Skittles, even though I guess there's a good argument that that can decrease anxiety, at least momentarily, right? But I'm not talking about Skittles. I'm talking about Swiss chard. I'm talking about red onions. I'm talking about green onions. I'm talking about yellow peppers. I'm talking about all of these different foods that have all of these different colors. What's so cool about the colors and the pigments in our food is that they correlate to these antioxidants, these chemicals that our bodies crave in order to lower inflammation. Another way that we can use nutrition as a way to moderate our stress is by increasing fats and proteins. So increasing fats and proteins in our diet helps to stabilize our insulin levels. Increased insulin and fluctuating sugar are a sure way to increase our anxiety. And we know this, right? We know this already. Sometimes we even see it in children, right? We say like, oh, wow, they must have had a lot of sugar because they're kind of bouncing all over the place. And so what for children may look like bouncing all over the place, it's a great time, we're having so much fun. When we bounce all over the place, we don't have so much fun, right? And we sometimes feel that as anxiety. So that's one of the things that we can do is to increase our fats and proteins. The other thing that we can do is balance our carbohydrates. So this doesn't mean only fats and proteins and no carbohydrates. So we're not talking about a keto diet specifically. But I am talking about eating healthy carbohydrates, carbohydrates that are made from whole grains that are going to metabolize slower. We're going to release sugar slower into the body. We're also talking about carbohydrates from root vegetables. And so carbohydrates that are also served with fats and proteins. So anything that we can do to slow down that stream of sugar into our bloodstream, that's going to prevent that insulin spike from occurring, which can trigger feelings of anxiety. It's also a good idea when it comes to nutrition to eat in a rhythm, in a healthy rhythm. So sometimes if we are too busy, maybe we're not eating enough, we can't remember to eat meals. So that can cause anxiety when the body goes into starvation mode. Sometimes if we've had dysregulated glucose, right, maybe we had prediabetes or we even have diabetes, then actually fasting might be a good way to decrease anxiety. There is some cool research being done about intermittent fasting and anxiety. So I would encourage you to take a look at that or talk to your clinician because that could be something that could help you. So going counterclockwise, now let's talk about stress. So moderating stress, of course, is going to decrease our anxiety. So a few different ways that we could do that. We could lower the amount of things on our plate. Now, many of us aren't going to go to that one first, right? We may think that's the easiest thing to do, right? If I could take some of these things off of my plate, then I would be less anxious. There may be a lot of truth to that. But if family life is one of the things driving stress, it may not be so easy just to move that off of your plate, right? If it's your job that's causing you stress, it's not always easy to just quit or to go get another job, right? Sometimes there are things in our life that bring us anxiety or stress that we're not going to just get rid of, but rather we're going to work around them. We're going to prioritize the things that are most important to our lives, the things that bring us joy, and we're going to work to make our plate bigger so that we can handle the things that are already on our plate. So one of my favorite ways to measure stress is by measuring heart rate variability. So that's something that we do here in the clinic, usually at our first visit. We're going to use a company called HeartMath to give us an idea of heart rate variability. So let's talk just for a moment about it, just so I can give you an idea of why it's important to measure. So heart rate variability lets us look at the sympathetic and the parasympathetic nervous system. So that's the fight, flight, freeze response. And then also the response in our nervous system that allows us to digest and controls our sleep patterns. So looking at those two things can give us a really good idea of how you deal with anxiety on a day-to-day basis. Are you stuck in fight, flight, or freeze? Many of us actually are. Many of us are constantly feeling like we're being chased by that lion. So being able to look at that objectively through a measure of heart rate variability can give me an idea of what's going on in my body and then what I can do to make changes. And then we can measure that over the time. I like to measure it every 3 months. Sometimes we'll measure it sooner, sometimes later, just depends on the individual patient. But I do think it's something important that we can look at. There are also a lot of apps that you can use. So the Apple Watch, for instance, has heart rate variability settings. Whoop, if you've heard of that, WHOOP, they have a great platform. It is a subscription, so sometimes that can be a little annoying. But even if you just get it for 3 to 6 months and just track heart rate variability and sleep, it can be really helpful for seeing what is making you anxious or stressful and the things that are also helping to bring down that anxiety. So there's other things that we can do to help with stress, such as meditation or prayer. And when we're talking about prayer, I mean, a lot of times people will use prayer sort of like a fireman, right? Like we just feel like our world is burning down, and now is the time that I need to pray and seek centeredness. And while I'm never going to discourage people from praying, right? I'm never going to discourage people from meditating, from taking a time out. I would encourage you that in prayer, we're seeking relationship, right? And in meditation, we're seeking centeredness. And I would encourage you that those be done as an exercise rather than just as sort of a fire alarm. So if we take a daily quiet time where we can meditate, where we can find our center in our being, in our creator, then that can be a great way to sort of reset our mind and our limbic system and prepare us for what the day brings. There's a lot more to be said about that, and I would like to talk about prayer and meditation in another group visit. But just for the sake of time, I will leave it at that. Now let's come up and, or let's go around, let's continue around counterclockwise and talk about relationship. So our relationships, and you may remember this from our first time together, where we talked about community. Relationship is vital to our well-being, and specifically to bring down our anxiety. So there's this very interesting idea. It's called attachment theory. And I think it is so helpful for understanding how relationships help impact and can help improve our feelings of anxiety. So a healthy attachment is going to be attachment to another person, a friendship. This could be, well, when we started out, like when we were born and very, very young, it would have been with our primary caregivers. But these are people in our lives who help us to feel seen, as in they know us, they know who we are. They understand our struggles. They know what makes us happy. They recognize that, and they show us that they recognize that. These are people who are going to help us to feel soothed. People that you go to that hear you, and they understand the pain that you're going through, the anxiety you feel, and they recognize what it takes to help you feel better, to know what you need to hear, to feel soothed. They also help you to feel secure. So a secure attachment and a safe attachment may sound similar, but security is something that happens over time, right? This is not really a one-time event, but being in a secure relationship is somebody that you can trust, or a group of friends, or a community in which you can trust. The reason why trust is so important is because it allows us to be vulnerable. It allows us to share the things that we may be ashamed of, the things that we're proud of, the things that we want other people to know about us, the things that we need other people in our lives to help us to figure out. That can only happen in a secure relationship. And then safety has to do with in the moment, right? In the moment, am I going to get hit by a car? Is somebody going to punch me? Is somebody going to say bad things about me and hurt my feelings? Hopefully the answer to those things is all no, right? And that has to do with our environment, a safe environment. Because it's only in a safe environment over time can we feel secure. So we need individuals who we are healthily attached to, and we also need community in which we find healthy attachments. And it is in those areas that we are then going to be able to let our guard down so that we can be less than anxious. So moving up, now we'll talk about movement. So movement consists of exercise. And so this could be exercise like HIIT training, high intensity interval training, which can be really good as long as it's moderated. I will sometimes see in patients who have been anxious or had really high cortisol levels for a really long time, that HIIT training is not necessarily the best for them. So if your adrenal glands have already been maxed out due to inflammation or emotional stress or anxiety for a long period, and I mean years, then taxing them with high intensity interval training is not always the best. So it could be hiking, it could be walking, it could be rowing. I mean, it could be any number of things. But the best studies that show that when you combine exercise with being outside in nature, that we're able to really reset the limbic system. Remember, we talked about the amygdala and how the amygdala can be revved up, right? And when the amygdala is revved up, then there's really no other option than anxiety. So movement in that way can really help to bring that down, to decrease the activity in the limbic system. And then last would be rest. So rest is so important. Rest is going to be sleep. So trying to get about 8 hours of sleep. Some of us need a little less, not much less, but a little less. And some of us need a little more, not much more, but a little more. So if you find yourself operating on 4 to 5 hours of sleep consistently over months to years, and you feel like that's enough, it may be that your body is just compensating. But on the other side, if you feel like you consistently need 9 to 10 hours of sleep, something's going on there. Your body is trying to tell you something. And I would encourage you to listen, to get that checked out, to get investigated. It could be that you're not sleeping well at night, maybe due to sleep apnea, maybe due to other issues that are not allowing you to get into a deep sleep or not getting enough REM sleep. So maybe you need a sleep study. It could be that your magnesium levels are off. So it could be any number of different nutrients that are causing that issue. So if you're not sleeping well, or you feel like you're sleeping too long, I would definitely encourage you to get that investigated. Then the other thing is recovery. So recovery, when I'm talking about this, I'm talking about from exercise. So when it comes to, a sprained ankle, we understand recovery, right? We understand that if I've sprained my ankle, it's swollen, it's red, it's hot, that I'm going to need to recover. I'm going to need to heal. Well, exercise is micro tears and micro sprains all over the different muscle groups that we've used, including the ligaments and tendons that we've worked. And it's important to allow your body to recover well so that we're not stuck in a state of inflammation. Because being stuck chronically in a state of inflammation due to under recovery will increase the sensitivity of the nerves, like I mentioned earlier, and can cause us to feel anxious. So making sure that you are sleeping well and making sure that you're recovering well are going to help you deal with anxiety. So I mentioned heart rate variability before. So I just love all the things that I've already mentioned about heart rate variability, but also it can be a tracker of our recovery. So by looking at our heart rate variability, by measuring it on something like the Whoop or on the Fitbit, you can get an idea the day after exercise on how well recovered you are. And you may need 2 days or 3 days before you can exercise at the same intensity again. If it seems like you're exercising and it takes 2 to 3 days to really recover, then you might want to just be careful, because this could be a situation in where you're really pushing your body too hard. Now, if you're an athlete, professional, or an Olympic athlete, then like there could be a really good reason why you're pushing yourself that hard, and that's understandable. But if you have other things that are going on, maybe you're not, maybe being an athlete is not your job, but rather your job is being a mom or a dad, or your job is in an office somewhere, or you've got other things that you're doing for the community that you need to be well rested for, then pushing your body to that extreme where it takes 2 to 3 days to recover is going to mean that it takes 2 to 3 days of you being kind of foggy headed, maybe feeling a little bit of fatigue and not being on your game. And that could really hurt long-term, whether it be in your job or in the work you're doing in the community or with your family or with your own creativity. So in the end, I want to make sure that no matter what you're doing for exercise, that you are recovering well. So hopefully talking about these 5 key strategies, or these lifestyle modifiers, that these can help trigger some ideas that you could talk to your clinician about, or maybe that's me. And I would encourage us to have that conversation and see if there's something in these areas, or maybe all of these areas, that we need to focus on to help deal with your anxiety. Or maybe it's an overactive limbic system because of anxieties or trauma that you've experienced in the past. And I would encourage you to investigate that. And we could do that through neurofeedback. We could get a brain map, and then we could recommend neurofeedback based on that brain map to try and dig in to see what is that underlying issues that are going on with your brain, where it might be stuck in hyperactive, or consider seeing a therapist, or both. We often see that neurofeedback and therapy, whether with a counselor or a psychologist, work hand in hand. Often those things work well together. So I would encourage you to investigate that a little more. And that brings us to the end of my presentation. Does anybody have any questions? I don't see any questions yet, but I want to give you guys a couple minutes to ask if there are any. Let's see. Check that. Okay. All right. I don't see any questions. So I hope you guys have a great evening. I hope you found this helpful. And again, if this brought up any questions, anything that you should, that you're curious about, that I would encourage you to bring it up with your clinician and go from there. Have a great evening. Oh, I do have a question. Oh, it's just a thank you. You're welcome. It was a pleasure. Bye, guys.